We got a nutritionist on board and a psychologist too. There are studies that if you follow up with the nutritionist and the psychologist, they lose more weight. We offer the gastric sleeve surgery. That is a restricted procedure where we remove 80% of your stomach and the remaining 20% is a tubular shape like a sleeve of a shirt or a coat. Roux-en-Y gastric bypass is a procedure that involves creating a stomach pouch from a small portion of the stomach and attaching it directly to the small bowel, thus bypassing a large portion of the stomach and the duodenum. And the SADI-S surgery, that is a combination by gastric bypass, like bypass between the duodenum and the ileum, with a sleeve. This kind of surgery is preferred in a high BMI patient or a recent diagnosed patient with diabetes. The eligibility criteria for weight loss surgeries. So if you have patients with a BMI of 35 or above, with or without any medical condition associated with obesity, is a good candidate for weight loss surgery. And if the patient with a BMI of 30 or above with a medical conditions associated with obesity called diabetes, sleep apnea, osteoarthritis, high blood pressure, high cholesterol, it's a good candidate too. In the gastric sleeve surgery, the time of the procedure is around 30-45 minutes. Gastric bypass, Roux-en-Y gastric bypass is probably 2 hours, 1 hour and a half. It depends on the BMI of the patient. And a SADI-S too, like 1 hour and a half, 2 hours, and depends on the BMI of the patient. So a higher BMI, if you want to proceed with a SADI-S, sign two consent forms because of the SADI-S can do in 2 steps. High BMI patients, you can do first the gastric sleeve surgery and wait 6 months to 1 year and complete the second step, that is the duodenal-ileal bypass. The international patient can stay over here the day of the arrival. If it's a gastric bypass, they're going to stay at the hospital 2 nights and 3 days. If it's a gastric sleeve, it's 1 night and 2 days. And the status is the same from the gastric and Roux-en-Y gastric bypass, 2 nights and 3 days. Yeah, the day of arrival, we take blood work, meet and greet if they have some questions about the surgery, and the staff is going to receive them. We got a nutritionist on board and a psychologist too. There are studies that if you follow up with the nutritionist and the psychologist, they lose more weight than if you only do the sleep or the bypass or their SADI-S.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.